So for those of you who don't know me, I'm chief leader writer and a columnist at The Observer, and I write for a left liberal newspaper. And if somebody had asked me how I felt about assisted dying 10 years ago, I'd have, said quite simply, yeah, I'm in favour of it. I'm a good left liberal. That is a position I should take. I've since changed my mind, and the reason for that is really because of some of the subjects that I write about as a journalist. I write a lot about child safeguarding, I write a lot about domestic abuse and coercive control, and it's writing about those subjects that really sort of started off my concerns. And I first wrote about my concerns about assisted dying a couple of years ago, so well before this is really kind of a matter of the national debate as it is now. So I just kind of want to run you through my concerns and why I've changed my mind about it. I'm not ideologically opposed to the principle. I think if I knew we could do it safely and that everybody who was opting for it genuinely wanted it, I wouldn't really have a problem with it. But my issue is I don't think we can do it safely, although I'm willing to be convinced. I think it's for proponents to convince me. And I certainly don't think that the bill that has been proposed is safe. So the reasons why I'm worried about it, and it touches on some of the things that James has talked about. So first of all, coercion and coercive control sounds like an incredibly technical term. But really what it's talking about is toxic relationships that are unfortunately all too common in society, where you've got one person who's very dominant, basically kind of bullying through a pattern of behaviour over time somebody else into feeling terrible about themselves, undermining their self-esteem and doing things that they wouldn't ordinarily do. And you see that in domestic abuse, which I've written a lot about, but it's also an issue in intrafamilial relationships when, for example, you sometimes got an older parent. And you hear that, loads of us will know about these situations, for example, where you've got, two adult children and there's a big disagreement actually around an older parent's care, and one adult child might think that actually the other adult child is not behaving appropriately towards that parent. We know from the World Health Organization that 1 in 6 older people suffer from some form of abuse, whether it's emotional or financial. We know in society more widely, 1 in 3 female suicides is thought to be linked to coercive control and abuse. And when it's very hard to detect coercion and coercive control and abuse, we know often that victims of it don't understand that it may not understand that it's what they're experiencing at the moment. I've spoken to lots of women who've been in that position. And it's very, very difficult to detect even after a crime has happened. So, for example, domestic abuse charities think there's well over 100 deaths of women a year that are recorded as accidental or natural, where they were probably killed by their partners. But the criminal justice system, just isn't any good at detecting that. And I know from journalists who work on these hidden homicides, how much painstaking journalism it takes to uncover when someone is already dead, if there was coercive control before they died, or if they were if they were killed or murdered. It can be very, very difficult. So and the criminal offence of coercion, I'm afraid, I've talked to criminal lawyers, that's just a paper safeguard. Coercion is very, very difficult to investigate by the police, and it's very, very difficult to prosecute. And the idea that in cases where there was coercion, that you're going to commonly get prosecution, I'm afraid that's just not what the criminal lawyers that I've spoken to think. I also think there's an issue around internal pressure and whether people feel it's something they ought to do, even if they don't want to do it, because it's something made possible by society. And you can see, it might be a pressure that someone puts on themselves. They've got this illness, they don't have that long left to live, and they require expensive care to live on. And, that might involve, for example, their children having to give up jobs to care for them. It might involve, an inheritance being spent on care. And you can see people opting for medically assisted suicide in that circumstance. I'm also worried about people with mental health conditions. If you speak to palliative care consultants, it's common response to terminal diagnosis to feel depression. But quite often those symptoms will alleviate over time as people adjust to their condition. And I think depression, if you talk to psychiatrists, it's subjective. How do we know if someone's depressed? How do we know if somebody is opting for this because they're depressed? And if it is because they're depressed and it's subjective and we don't really know, where do we draw the line as a society between suicide prevention on the one hand and medically assisted suicide on the other? I think that's a really, really difficult conversation and challenge for us as a society. I'm also really concerned about the gendered aspects, both of pressure and internal pressure and coercion and undue influence and pressure. And I just don't think that maybe there are some safeguards that could better detect or look out for coercion, but doctors are not trained in spotting coercive control. I've spoken to doctors, they're like, how are we supposed to do this? That's not going to work. And the reason why so many retired judges have spoken out about their concerns about the bill is this is just asking judges to essentially be a rubber stamp. We know even in the family courts, I've written a lot about the family courts, where there are allegations of domestic abuse and coercive control, when judges have investigatory fact-finding powers, when they've got agencies like CAFCAS involved and they've got social workers reporting to them, even then we know judges get it wrong. And we know that because there are appeal judgments from the High Court that show that first instance judges get this wrong. And judges do get it wrong. And that's why retired judges are so concerned about this. It's a rubber stamping exercise. But even if they had investigatory powers, how do we know they're going to figure out when people are under coercion? If you've written about coercive control and the difficulties in detecting it and uncovering it, you understand that when you're starting to talk about the state assisting people to die, it's really, really concerning for those of us who know a lot about safeguarding and domestic abuse. Just a couple more things I want to say. One is on the slippery slope. So people say, well, there's no slippery slope because it has to come back to Parliament and MPs will decide. So these are very tight, restrictive criteria. I think there are really big questions about whether we can keep something tightly defined. First of all, terminal illness with 6 months to live. It doesn't sound subjective if you don't know much about medicine. But it is. Again, if you speak to palliative care specialists, they say that life expectancy beyond a few days is just a guesstimate. So it's really going to be about whether doctors sort of, like whether you've got 6 months to live, 12 months to live. It's very, very hard to be accurate. So that leads to subjectivity as well. And it will depend a lot on the doctor you go to. And I think there'll be some doctors that get known for signing this off. Terminal illness, again, there's no fixed definition of that. In the US, in 3 states, there have been 60 instances. It's probably a real underestimate because the monitoring data is so poor there, but 60 instances of when people, mostly women, young women with anorexia, have been helped to die. And anorexics that I know who work on this issue are horrified by that because they say actually in medicine there are some doctors who give up far too easily on people with anorexia, and they say as survivors of anorexia they would have absolutely picked a medically assisted suicide in the moment their bodies were possessed by this disease. And yet, in Oregon, it's a matter of policy, not law. It's just doctors saying, we define this condition as terminal. And in some cases, it's been defined as severe malnutrition. There's not even any reference to anorexia. So I think that's really concerning. And then on the palliative care point, we know 300 people a day are dying without access to the palliative care they need. Yes, it doesn't need to be an either or in theory, but it is in practice because we aren't investing the resources that we need in palliative care. And proponents of this bill haven't secured a commitment from Rachel Reeves that palliative care is going to get the funding it needs. I think we should all be trying to get that commitment for her. But that's going to put doctors in a position where they have to say to people, we can't get you a hospice place. We can't do what you need in terms of end-of-life suffering, but we can offer you a prescription for lethal drugs so you can take your own life. I just think that that's really, really dark, and we need to think very carefully about going there before we've ensured that we've got the palliative and social care systems that ensure that people won't feel that they have to take their own lives because the care that they want is not available. And I think it is I've written a lot about social care. It's a massive problem. We don't have the care we need. Ultimately, there are so many experts that I respect. There are retired judges, former chief coroner, there are seasoned cases, including those who've represented appeals to the Supreme Court to try and get assisted dying legalised. There are psychiatrists, there are palliative care doctors. They're often people who are not ideologically opposed to assisted dying like me, but they just don't see how this bill can work and the proposals on the table can work. And when you've got experts at that level who are really, really worried about it, you've got to say, why are MPs considering voting this bill through? Why hasn't a different process been taken? There's such huge outstanding questions about this bill. James mentioned monitoring. Monitoring is really key because if you think that you've got to have safeguards, you've got to monitor if those safeguards work. I can tell you, this monitoring systems in places like Oregon, even the most basic data is missing, and there's no details of that monitoring in the bill. It's just chief medical officers going to do it, nothing. there's no way I, as an MP, could vote for a bill unless I know exactly how some of these things are going to work. And what you really need is something like a royal commission of experts who can look into these questions, who can investigate whether it can be done safely. I'm sceptical, but at least say there are these risks and put some kind of figure on the risk. So at least we know as a society, are they risks that we can tolerate? How many potential state-sanctioned wrongful deaths are we willing to tolerate in order to alleviate the suffering of some others? And I think there are people who make very powerful cases for assisted dying, but this is a balance, and we've got to be very clear about that. And one of the things that concerns me a lot about this debate is the language. So I'm worried about, actually, this is a conversation that is making us more scared of death. I've had very comforting conversations with palliative care specialists that don't go along the lines of what James has been saying, actually, in terms of suffering at the end of life. Yes, there are some conditions where there is suffering, and that is terrible. But most people with great palliative care could have a much, much better experience of death. And actually, I think that some of these stories we're telling ourselves make it more difficult for us to have that conversation. So I really, as a skeptic, but somebody who's not ideologically opposed, I think the debate has been very, very poorly handled. I think there have been so many people who've been saying, there are no risks. We don't need to worry about these safeguards. I'm sorry, but the number of experts who are concerned says we should be worried. And if you're genuinely interested in engaging with skeptics like me, people who are worried, pushing through a private member's bill where there are so many questions, so many unanswered questions, is just not the right way to do it. You're not bringing along the skeptics. So that's my appeal to the proponents. You've got to have a different process around this. We need a royal commission.